Hey everyone, and welcome to today's Explainer. We're tackling a topic that honestly almost every single one of us is going to face at some point. We're breaking down everything you need to know about urgent care X-ray services, pulling facts directly from the Essential Guide to Urgent Care X-ray Services. If you've ever wondered where to go, what it's going to cost you, or if it's even safe when a sudden injury pops up, you are in the exact right place. We're going to cut through the confusion and get you straight answers.
Okay, let's dive right into this. We've all been there, right? I call them the uh-oh moments. You're playing a casual game of basketball, and suddenly, snap, you twist your ankle, or you're at the park and your kid takes a really scary tumble off the monkey bars, or, maybe it's not a sudden injury at all. Maybe you've just had this lingering, heavy cough for 3 weeks, and your doctor really needs to rule out pneumonia. In every single one of these super relatable scenarios, getting an X-ray is absolutely crucial. It's the first step to getting answers and, more importantly, getting better. So here's our roadmap for today. We'll be looking at 1. When you need an X-ray. 2. What X-rays actually diagnose. 3. The cost of an X-ray. 4. Radiation safety and your health. And 5. Fast walk-in X-ray availability.
Let's kick things off with sections 1 and 2, when you need an X-ray and what X-rays actually diagnose. To really grasp how valuable these scans are, just look at how often we use them. There are over 300 million medical X-rays performed every single year in the U.S., and primarily we're talking about bone and joint conditions. X-rays are literally the gold standard for detecting broken bones. Whether you've got a tiny hairline fracture in your wrist, a stress fracture in your foot from running, or a much more obvious break in a long bone, an X-ray gives your provider a crystal clear look at your bone structure. It also shows joint alignment. That's how they spot joint dislocations, bone spurs, and even early arthritis. This visual proof is exactly what helps a provider instantly decide, do you just need to ice a sprain, do you need a cast, or do we need to get you to an orthopedic surgeon right away? But here's the thing. X-rays aren't just for broken bones. They're actually essential for chest conditions and other emergencies too. If you're having chest pain or trouble breathing, a chest X-ray gives a super rapid initial check for things like pneumonia, bronchitis, fluid around the lungs, or even an enlarged heart. And for all the parents out there, X-rays are a lifesaver for locating swallowed foreign objects. Metals, glass, and certain plastics pop right up on these images. They can even evaluate facial bone fractures or those severe sinus infections that just refuse to clear up.
So the crucial point here is understanding what this technology can't do. We gotta set realistic expectations. X-rays are phenomenal for bones and chest evaluations, for sure, but they cannot clearly see soft tissue. So if you've got a torn ligament, cartilage damage, or an issue with an internal organ, an X-ray might be step 1, just to rule out a broken bone, but ultimately, you're going to need an MRI, a CT scan, or an ultrasound to actually diagnose that soft tissue damage.
Moving right along to section 3, the cost of an X-ray. Now let's talk about something that can honestly hurt almost as much as that twisted ankle. The medical bill. It's a huge source of anxiety for most of us. So let's break down exactly what you're going to pay at an urgent care clinic. The financial picture here is actually pretty manageable. If you have insurance, diagnostic X-rays ordered by a provider are generally covered as medically necessary. So you're usually just looking at your standard copay, which normally sits between $25 and $75. But what if you don't have insurance? Well, the out-of-pocket cost at an urgent care generally falls between $100 and $250 per view. What's really great about urgent care pricing is that it's transparent, and it almost always includes both the imaging itself and the provider reading those images. And this brilliantly illustrates why where you go matters so much. If you take that exact same scam and go to a hospital-based imaging center or an ER, they'll often hit you with a bill between $300 and well over $1,000. Going to urgent care for a standard diagnostic X-ray offers massive financial relief, and you aren't sacrificing image quality or the care you get. All right, section 4, radiation safety and your health. So once we're past the sticker shock, the next big worry is usually physical risk, specifically radiation. I want to bring a really reassuring fact to the table here. Yes, X-rays use ionizing radiation, but modern technology has vastly minimized the risk. 0.1 millisieverts, that's it. That is the extremely low dose of radiation you're exposed to during a standard chest X-ray. And if you're getting an extremity X-ray like your hand, wrist, ankle, or foot, it's even lower than that. Modern digital equipment, like the state-of-the-art systems they use at Mederi Urgent Care, require way less radiation than the old clunky film-based systems from back in the day, and they actually produce clearer images. Now, what's really interesting about this slide is the real-world context it gives us.
Numbers like zero.1 millisieverts sound super abstract, right? But think about it like this. A standard chest X-ray gives you the exact same amount of radiation you naturally absorb just by existing in the environment, walking around, living your everyday life over the course of 10 days. When you see it compared to everyday background radiation like that, it's an immediate aha moment. It's a huge relief to know how safe modern X-rays really are. Now, there is an important standard precaution if you're pregnant, or even think you might be. You definitely want to avoid unnecessary X-rays, especially to the abdominal area. The key takeaway here is just communication. Always tell your provider before any imaging happens. But even then, if you twist your ankle while pregnant, extremity X-rays can usually still be done safely using proper lead shielding to protect both you and your baby. And that brings us to a question I know every parent watching is probably asking. Your kid just took a scary spill off the monkey bars, and your very first thought is, wait, are X-rays safe for my children? The answer is a very firm, reassuring yes. Pediatrics X-rays aren't just adult X-rays done on kids. They use specifically adjusted, much lower radiation doses that fit a child's size perfectly. When your kid is in pain and might have a broken bone, the diagnostic benefit of finding and treating that fracture far outweighs the absolutely minimal risk from the radiation. It's a totally safe and wonderfully necessary step to get them treated properly. Which brings us to our final part, Section 5, fast walk-in X-ray availability. So we know they're safe, effective, and affordable. Now let's talk convenience, because that's one of the biggest perks of urgent care. You don't have to deal with chaotic hospital waiting rooms or wait weeks for an outpatient appointment. But there's a huge misconception that stops people from actually using this service. People constantly wonder, do I need a doctor's order or a referral first to get an X-ray at urgent care? Let's move to and see how this builds a totally stress-free experience, using Mederi Urgent Care as our example. The answer to that question is absolutely not. You do not need a separate referral or prescription. It's so straightforward. Step 1, you literally just walk in, check in at the front desk, and tell them what's hurting. Step 2, an on-site provider examines you and decides if an X-ray is needed. Again, no prior order required. Step 3, a technician gets you positioned, which takes, maybe 5 to 15 minutes max. And step 4, the provider reviews the digital images right then and there, giving you the results in your treatment plan during that exact same visit. So if you're in Southern California and find yourself needing a fast, on-site digital X-ray, Mederi Urgent Care has got you completely covered. They have state-of-the-art equipment at all 4 of their LA area clinics: Hollywood, Glendale, Los Feliz, and West LA. The convenience is just unmatched because they're open 7 days a week from 9 a.m. to 9 p.m. You can literally just walk right in, or if you're the planning type, you can call them at 213-442-1890 or hit up mederiurgentcare.com. I want to leave you with this final empowering thought from today's explainer. Look, when you're in pain or you're stressing about a possible fracture, time is everything. Why wait days for an appointment or blow thousands of dollars sitting in a crowded ER when accurate answers and immediate relief are literally just a simple walk-in away? Urgent care X-rays are safe, they're affordable, and they work. Thank you so much for hanging out with me today to learn how this whole process works. Stay safe out there, and I'll catch you in the next explainer.